언제부터 이런 증상이 있었어요?
한 약 4개월 정도 됐습니다. 처음 알기.
옛날에는 전주증이 없었어요?
네.
사경증을 비롯해서 또 불편한 증상이 있으면 얘기해 보실까?
네, 양손으로 뭘 하면은 일을 제대로 못하고 자꾸 돌아가고 해.
잡아야지 일할 수 있어서?
네.
또?
그리고 걸어갈 때도 자꾸 목이 돌아가고.
앉았을 때 더 움직여? 아니면 걸을 때 더 움직여? 고개가?
그럴 때 더 움직이는 것 같아요.
이렇게 치료를 진행합니다. 이렇게 해줘. 이 자세를 뇌에 입력시켜내고 처음보다 비하면 몇 점이 좋아졌을까? 10점 만점에? 3점? 드셨어요?
별 다른 없었습니다. 좋았습니다.
좋았어?
네.
어떤 면이 좋았어?
아마 자세 잡는 게
응.
목도 잘 안 돌아가고. 근데 양손으로 막 움직이고 이러면 조금 힘들더라고요.
지금 거기
네.
잘 되네?
네.
한 달 20일 동안 뭐가 제일 많이 좋아졌어요?
그럴 때 안 돌아가는 거고요. 앉아 있을 때도 이 목 같은 게 조금 편해지고 했습니다. 목 뻐근한 것도 조금 나아진 것 같고요. 조금 이 피곤하고 이러면 이게 좀 심해지더라고요.
몇 점 유지가
지금 한 93.
많이 써봐봐요. 흔들리나 보게.
지금은 안 나는데요.
남아있는 게 몇 프로 같아요? 본인 생각에? 5%?
FCST is abbreviation of Functional Cerebrospinal Therapy. It is treatment to control whole body's yin yang balance through balancing TMJ. The purpose of balancing TMJ is upper cervical alignment, spinal alignment, nervous system stabilization, and natural healing of body. That is to say that FCST helps to open up the blood channel that connects brain and body, realigning the spine, stabilizing nervous system. What factor causes misalignment of spinal structure? The answer is in C2, which is the one and only central axis of the spine. Then why is the C2 important? Human body has 24 vertebrae, which includes cervical, thoracic, and lumbar. Of all these vertebrae, there is only one vertebra with an axis, the C2. Our body is affected as axis C2 is distorted. When the axis C2 is distorted, the LSC1 is also immediately distorted, and the rest of the vertebrae in the spine will soon follow, as will the pelvis and cranial bones, like in the domino effect. Consequently, it will lead to the cranial structure fixation and the restricted flow of cerebrospinal fluid. Then, there will be problems on the circulation and central nervous system. What factor causes misalignment of axis C2? The answer is imbalance of TMJ. Once the C2 are distorted due to the TMJ imbalance, the entire structure will follow and distort. And this will negatively impact on the brain-body communication through restriction of foramen magnum as well as restriction of jugular foramen, another opening in the base of the skull transmitting veins and arteries. When the TMJ disc space is normalized through TMJ balancing therapy, C2 is aligned as well as the size of foramen magnum is normalized. I've explained in what aspect I see the disease and its principles and concepts. I put everything in one diagram for the summary. For the better understanding, I rotated the horizontal diagram in the previous slide into the vertical diagram. The treatment applied to the higher rank can be the treatment in the lower rank. In the lower rank, more specific therapies are applied. I consider balancing TMJ as top priority factor to resolve structural problems. For the TMJ balance, I make use of intraoral devices as our main treatment. There are two types of intraoral devices used for balancing TMJ. CBA is disposable custom-made intraoral balancing appliance which allows balance of TMJ at the optimal freeway space to the individuals until deflection. The purpose of CBA is to align C2 at all times through balancing TMJ in relation to maxillary and bodily posture. TBA and OBA are intraoral devices for keeping TMJ balance stable after the use of CBA when deflection has occurred, and keeping C2 in aligned position and stabilization of occlusion and mandible. I apply a wide range of therapies other than TMJ balancing therapy. These therapies are applied for structural alignment. There are upper cervical and spinal alignment technique, spine balancing therapy, craniosacral therapy, and disc decompression balancing therapy. There are other secondary therapies as well. Depending on individual's condition and need, I apply different types of secondary therapies like as acupuncture, cupping therapy, herbal medicine, counseling program, and rehabilitative exercise program. This chart shows the number of cases in my clinic from 2002 through 2013. I listed several diseases based on the highest ratio of patients.